I'm Dr. Dan Kassicieh with Sarasota Neurology. I'm a board-certified neurologist and I have been practicing in the Sarasota area for over 20 years. A neurologist specializes in disorders and diseases of the nervous system. That not only includes the brain and spinal cords and nerves in our hands, arms, legs, and feet, but also muscle conditions, neck pain, back pain, headaches, seizures, Parkinson's disease, tremor, all those type of things, stroke, TIAs, little mini strokes, all those things involve neurology. Other common problems that I see are things like dizziness, vertigo, numbness, walking trouble. All of that involves neurology. Neurology really involves the entire electrical wiring of the whole body. So anything that affects the body in its electrical functioning is covered under neurology. I'm a DO, which is Doctor of Osteopathic Medicine. It's similar to an MD, except osteopathic physicians have about 200 hours of classroom training more in medicine, and that specifically deals with osteopathic medicine, which is the specific study of disorders of the spine, of the muscles and bones, and how it interacts and interrelates to other parts of the body. So trouble in one part of the body can cause neck or back pain and can cause other problems. So we also study that as well and incorporate that into standard medicine. The majority of what I treat on a day-to-day basis is head, neck, and back pain, but my area of particular subspecialty interest and training is in headaches. Headaches are a complicated medical condition. Not everything's migraine, not everything's a muscle tension headaches. There's probably 6 or 7, maybe 8 different types of headache disorder. And the interesting thing is that a lot of the patients that I see may have 2, 3, or even 4 different types of headaches, all requiring different types of therapy. So that's why it's important that if you have persistent headaches, you should see a neurologist who has subspecialty training in treatment of headache disorders. We see conditions called movement disorders. Movement disorders are anything that's an abnormal movement, a twitch, tremor. Tremor is probably the most common movement disorder that we see. Parkinson's disease. Some patients with Alzheimer's disease can have little twitches or tics, but that all comes under the heading of movement disorders. And patients need to remember is that not everything that shakes is Parkinson's disease. I see patients that were diagnosed with Parkinson's disease and they've had this tremor and that's all they've had for 30 years. They don't have Parkinson's disease. They have plain old tremor. And that requires a completely different treatment than Parkinson's disease. Tremor usually is not progressive. It gets to a certain point and then levels off, and all it is shaking. That's all it is. Some people it bothers them, other people don't need treatment. Parkinson's disease, however, is a progressive neurodegenerative illness, second only in commonality to Alzheimer's disease, which is the #1 neurodegenerative disorder, and I also treat that as well. If you're suffering from head, neck, or back pain, or any kind of joint pain, don't hesitate. Call Sarasota Neurology at 941-955-5858 for an appointment. You'll get an objective consultation. It does not commit you to any other treatment, but at least you'll have your treatment options which do not involve surgery or narcotics. Call now at 941-955-5858 or visit us online at sarasotaneurology.com.